Good day, students. Welcome back to Basic Science class. In our previous lessons, we looked at prevention of sexually transmitted infections, which are STIs, HIV/AIDS, and we said that STIs are diseases that can be passed from one person to another through sexual intercourse. They are diseases that are only transferred through sexual intercourse with an infected person. And we looked at example of STIs. We looked at things like chlamydia, we mentioned syphilis, we mentioned gonorrhea, we mentioned also HIV and AIDS. And in our last class, we were able to discuss chlamydia. We look at the causative organism, the mode of infection, the symptoms, and prevention. In our class today, we'll be looking at or considering gonorrhea, which is another example of sexually transmitted infection. Gonorrhea. And like we said, gonorrhea is also being transmitted or transferred through sexual intercourse with an infected person. It is caused by an organism, a microorganism called Neisseria gonorrhoeae. This microorganism belongs to the group of microorganisms bacteria, and it's a bacterium called Neisseria gonorrhoeae. I said gonorrhea is caused by a bacterium called Neisseria gonorrhoeae. Method of spread. How is gonorrhea spread? Gonorrhea is mainly transmitted through sexual contact. You know it's a sexually transmitted infection. So it's mainly transmitted through sexual contact, but there are other ways apart from sexual contact. Mothers infected can also transmit the disease to their babies during delivery. If we have an infected mother that has not been treated, this disease can be passed from the mother to the child during delivery. Symptoms. Symptoms are signs that appear in the individual or that show in the individual or that the individual experience to show the manifestation of gonorrhea. In women, the symptoms include painful urination. The individual infected will be experiencing pain when it's passing out urine, and increasing amount of discharge from the vagina. The individual will also experience discharge from the vagina, which is abnormal. The symptoms in men, symptoms differ, like we looked at during chlamydia. It differs in men and also in women. In men, symptoms. In the men, the primary symptom is painful urination. That's the primary symptom. That is the one that men mostly experience, painful urination. Then discharge is also seen from the urine passage. Men also experience discharge from the urine passage. Prevention of gonorrhea. Prevention of gonorrhea. How is gonorrhea prevented? Number 1, abstaining from sex if not married. Abstinence is the surest and the best way of preventing STI for the unmarried. If you are not married, stay away from sexual intercourse. 2, if you think you may have been infected, you and your partner should consult a doctor for treatment. This one is for the married. If you think you are infected, if you begin to see symptoms that we mentioned, if you are experiencing some of these symptoms, talk to your partner about it, and the both of you should consult a doctor for treatment. Because if one person should go and get the treatment, if the other partner is already infected, even after that treatment, your partner will reinfect you. 3, have a medical test at intervals of time. We need to go for medical checkup at intervals of time to ensure our health status. Number 4, use a condom regularly. This one too is for the married that think they might have been infected and cannot stay away from sex, so you can use a condom regularly. 2. Syphilis. The next disease is syphilis. Causative organism is caused by the bacterium Treponema pallidum. Syphilis is caused by the bacterium Treponema pallidum. Treponema pallidum. Method of spread: through direct contact with syphilis sore. A sore is an open wound. So when an individual comes in contact with a syphilis open wound, the individual will get contacted. Sores occur mainly on the vagina, anus, or in the rectum. In the vagina, in the anus, mostly in the anus for people that go through anal sex. Homosexuality, which is a terrible way of life now, has become a common norm. When individuals of the same sex, specifically men, having sex with themselves, they use the anus as a passage for that. So you can, if that happens and the person is infected, you see the sore occurring in the anus. And if it's a female, you see the sore occurring in the vagina. The rectum is the extension of the anus from above. Pregnant women with the disease can pass it on to the babies. Syphilis cannot be spread through contact with toilet seats, doorknobs, swimming pools, bathtubs, shed clothing, and eating utensils. Syphilis cannot be spread through these ways. They are only and mainly spread through contact with an infected person. Symptoms of syphilis. Syphilis has 3 stages in its symptoms. The first stage is the primary stage, second is the secondary stage, and the last is the latent or the hidden stage. The primary stage, the secondary stage, and the latent stage. And the symptoms varies from one stage to another. So we look at the symptoms in the various stages. Stage 1, that is the primary stage. Appearance of firm, small, round, and painless sore. The individual will see a sore will appear, and that sore is firm, is strong, is small in size, is round, and is painless. It's not painful. You will not experience pain. From about 10 to 90 days of exposure to the bacterium. Once an individual is exposed to the bacterium, in between 10 to 90 days, the individual will see this sore on the vagina, in the rectum, or in the anus. Exposure to the bacterium, which will last for about 3 to 6 weeks and heals without treatment. This sore, once it appears, it lasts from about 3 to 6 weeks and it heals without treatment. Secondary stage, skin rash. The individual experiences skin rash in various parts of the body, such as palms, soles, and other body parts. Palms of your hands, the soles of your feet, and other body parts. Others are sore throat, fever, patchy hair loss, headache, weight loss, muscle ache, and weakness. These are other symptoms, together with the rash in the palms and the soles. So the individual will also experience sore throat, pain in the throat because of some sores that have appeared in the throat. And remember, we say sores are open wounds. Fever, patchy hair loss. The individual will experience hair loss. The hair will be falling off in patch. Headache, weight loss. The individual will lose weight, muscle ache and weakness. The individual will experience muscle pain and also weakness. There's difference between muscle ache and muscle pull. It's not muscle pull I'm talking about. I'm talking about muscle ache. Ache, pain in the muscle. Symptoms of the latent stage. Now, remember we said we have the primary stage, the secondary stage, and the latent or the hidden stage. That's the third stage now. The third stage is the latent stage. It's also called hidden. The word latent means hidden. It's not seen. The other ones are seen, like the sore in the vagina can be seen. But this one is hidden because disease may damage the internal organs. These ones affect the internal organs of the individual. That is why we call it latent or hidden, because it's not visible. Such as the brain, the nerve. Nerves are message carriers located at different parts of our body, and they are connected to the brain. They transmit information to the brain. So we have the brain, we have the nerves, we have the eyes, we have the heart, we have blood vessels. Blood vessels are pipes or tubes through which blood flows in our body. The arteries, the veins, and the capillaries. Liver, bones, and joints. Bones and joints. The damaged internal organs leads to difficulty in coordinating the muscle movement. So because of this damage of these internal organs, the muscles will not be coordinated. Can also lead to paralysis. The individual become paralyzed. And then we also have numbness. And then we have gradual blindness and loss of weight. Gradual blindness and loss of memory. Gradual blindness and loss of memory. Gradual blindness and loss of memory. These are the latent symptoms in the stage of syphilis. These are the latent symptoms in the stage of syphilis. And numbness simply means inability or reduced ability to experience emotion. Inability or reduced ability to experience emotion. That is numbness. Prevention of syphilis. Prevention of syphilis. Abstaining from sexual contact or limit sexual relationship to one wife or husband who is free from the disease. Remember we said abstinence is the surest and the safest way of preventing sexually transmitted infection. So if you are not married, abstain from sexual contact. And then if you are married, you must limit your sexual relationship to your husband or to your wife. No promiscuity. 2. Both partners going for medical treatment when infection is suspected. I told you that if the two partners are infected and one person got the treatment, when he returns back after he completes that treatment, by the time he has sexual intercourse or she has sexual intercourse with her husband, she becomes reinfected. So the treatment must be for the both partners. This has brought us to the end of our class today. When we meet next, we'll look at HIV/AIDS. HIV/AIDS. Thank you and have a nice day.